The science of comfort. Gentle holding techniques and resolving bottle refusal in infancy introduction. Connectivity. Behavior and the expert mindset. The early months of infancy present unique challenges. Two of the most common being the difficulty in soothing a fussy baby due to incorrect holding techniques and the sudden onset of bottle refusal, often after initial acceptance. From an expert perspective, these aren't signs of a difficult baby, but rather logical responses from a developing nervous system and a sophisticated digestive tract reacting to physical and flow changes. We must recognize that holding an infant is not merely physical support. It is a profound form of communication and a critical way to establish psychological safety. Likewise, bottle refusal, while frustrating, is a complex interplay of oral motor skills and flow preference. This comprehensive guide aims to transcend instinctual parenting, moving towards a style rooted in scientific understanding and gentle technique. Our goal is to equip parents with the knowledge to interpret their baby's cues, fussiness, and refusal through the lens of infant reflexes, behavioral psychology, and effective feeding strategies. The science of comfort. Decoding fussiness and crying. Issue 1. Fussiness and crying often signal a misalignment between the baby's physical needs and the way they are being held. Understanding the underlying reflexes is key to successful soothing. Infant reflexes and the need for physical containment. Moro reflex, startle reflex. This involuntary reaction is triggered by a sudden change in position or loud noise, making the baby feel like they are falling. If a baby is held without adequate support or containment, the Moro reflex is constantly triggered, leading to sudden crying and resistance. Gentle, secure holding techniques are essential to override this reflex and calm the nervous system. The vestibular system. Located in the inner ear, this system controls balance and spatial orientation. Infants thrive on rhythmic, slow, and predictable movement, gentle swaying or rocking, because it mimics the environment they experienced in the womb, providing a calming input to their sensory system. Common holding mistakes. Causing discomfort, incorrect holding positions can place undue stress on the baby's developing body. Incorrect holding. Position physical issue causing discomfort. Consequence, crying. Symptom upright without back support, undue stress on the fragile spine. Head flopping or excessive movement. Crying due to pain instability. Frequent startling completely flat on their back, lying. Inhibits efficient swallowing. Increases risk of physiological reflux or gas. Fussiness after feeding. Frequent spitting up. Prolonged, distressed crying. Too tight or too loose embrace too tight. May cause overheating. Constrict chest for breathing. Too loose. Creates a sense of insecurity. Triggers startle reflex, arched back. Sharp, distressed cries. Struggling to move away. Expert-approved, gentle holding techniques. The right holding technique prioritizes support, alignment and security, skin to skin. Contact. Essential for immediate calming. When the baby is awake and alert, skin-to-skin contact on the parent's chest regulates the baby's heart rate, breathing, and temperature, promoting oxytocin release, the bonding hormone, in both parent and child. The proper cradle hold. Always support the entire back and neck, ensuring the baby's head is aligned with their spine, not tilted back or too far forward. The baby should feel fully enveloped, replicating the secure feeling of the womb. The over-the-shoulder or upright hold for digestion. Holding the baby upright, resting their chest against your shoulder, is ideal for burping and can significantly reduce discomfort from reflux or gas by utilizing gravity. The 4 S's. Soothing technique. Developed by Dr. Harvey Karp. This method uses 4 key actions to activate the baby's calming reflex. Swaddle, containment. Side stomach, holding position for soothing. Shush, white noise. And swing, rhythmic movement. T. Resolving bottle refusal, flow preference nipple confusion. Issue 2. When a baby who previously took a bottle suddenly starts refusing it, The cause is rarely behavioral stubbornness and almost always related to oral motor mechanics or flow rate preference. The physiological mechanism of refusal nipple confusion versus flow preference. These terms are often used interchangeably but have distinct meanings. Breastfeeding requires an active latch and compression. Tongue and jaw muscles work hard to express the milk. The flow is slower and self-regulated by the baby's effort. Bottle feeding requires a simpler sucking motion, less tongue engagement, because the flow is passive, faster and often continuous. Flow preference, after experiencing the rapid, effortless flow of a bottle, even when labeled slow. The baby quickly adapts and may become lazy or resistant to the slower, more laborious process of extracting milk from the breast. This is a crucial point. The baby prefers the ease, not the vessel. Timing and psychological roots. The sudden onset. Refusal often peaks after the 6 to 8 week mark, coinciding with the baby's increased awareness and a more developed sense of preference regarding the feeding method. The mental factor. Babies bond with the mother during breastfeeding for both nourishment and intense closeness and security. A switch to a bottle, particularly with the mother, can be rejected because it breaks that established psychological routine and bond. Expert strategies for overcoming refusal, the triple P approach. Resolving refusal requires careful adjustment of technique, environment, and personnel. A. Paced bottle feeding technique, mimicking the breast. This is the gold standard. Hold the bottle horizontally, not upside down, to slow the flow. Allow the baby to take breaks and breathe. This forces the baby to work harder, mimicking the breast's flow rate, and prevents the fast flow preference from worsening. Nipple selection. Use a preemie or newborn flow nipple, even if the baby is older than 2 months. The goal is to make the bottle flow as slow as possible to encourage the baby to use the same muscles they use for breastfeeding. B. Personnel and environment. Preparation and placement. Use an alternative feeder. When introducing the bottle, the mother should leave the room entirely. The father or another caregiver should offer the bottle to dissociate the bottle from the breast. Babies often understand mom on breast and may refuse the bottle if the mother is nearby. Optimal timing. Offer the bottle when the baby is calm but not starving. A frantic, hungry baby will quickly become frustrated with the slower paced method. Offer the bottle in a quiet, low-stimulation environment. C. Prioritize comfort and closeness skin to skin during bottle feeding. The non-nursing parent should also use skin-to-skin or close holding positions while bottle feeding to maintain the bond and security the baby associates with feeding time. Use breast milk in the bottle. Initially, use pumped breast milk in the bottle so the baby is comfortable with the familiar taste and smell while adjusting to the new mechanics. RV. Lifestyle mindset. Building a secure and connected environment, successful soothing and feeding practices stem from a parent's calm, informed mindset. 1. Understanding crying as communication, the language of crying. Reassure parents that crying is the baby's only form of communication. Learn to differentiate between different cries: hunger cry, fatigue cry, distress cry, colic, reflux, and connection cry. The 5-minute rule. When the baby cries, parents should systematically check all basic needs: diaper, temperature, hunger, before resorting to a new holding position or feeding attempt. This prevents an impulsive reaction and ensures the correct need is met. The mindset of sustainable parenting: flexibility and acceptance. Accept that infant needs change rapidly, e.g., during growth spurts. What worked last week might not work today. Rigidity in parenting only breeds stress and frustration. Parental stress management. Parental stress is easily transmitted to the baby, increasing their tension and crying. Stabilizing adult emotions through self-care and seeking help is the foundational step to successfully soothing a baby. A calm parent fosters a calm baby. V. Conclusion. The journey of informed care. The challenges of soothing a fussy baby due to holding errors and overcoming bottle rejection are central to early parenthood. They are complex puzzles that require a solution based on scientific technique and empathetic awareness. The expert takeaway. Safety. First, comfort second. Master correct holding techniques to support the baby's physical structure and soothe the nervous system by overriding the Moro reflex. Flow is key. Resolve bottle refusal by understanding flow preference and implementing the paced bottle feeding method using an extra slow flow nipple. Connection is critical. The best care comes from learning to read your child's subtle cues, turning confusion into genuine understanding. The goal is to blend scientific knowledge with unconditional love. Start today by practicing safe holding positions and implementing the paced bottle feeding technique with patience and commitment. The most effective parenting skill is the ability to adapt and connect with your child's unique needs.